Page 499, with cancer. We're going to talk about chemo and radiation, right? Very big on NCLEX. You don't go and learn all the chemo drugs. I don't know them. You won't know them. The people who make NCLEX don't know them. Your job is to know about radiation. Your job is to know about chemo and how to care for the patient that is on chemo and radiation, right? The first box is 42-1. The box says breast cancer. Once you have breast cancer, it metastasizes, means spread to the lungs. That's why anytime you find a lump, the first thing the doctor do a chest x-ray. Why? To see if the cancer what? Spread. So the doctor will do a bone scan and a lung scan, right? Chest x-ray, excuse me. Anytime you have lung cancer, page 499, it's spread to the brain. So you will do EEG, right? Once you have colon cancer, it's spread to the liver. Prostate cancer, it's spread to the bone, spine, and leg. Brain tumor, anytime you have brain cancer, it's spread to CNS, right? Make sure you know that. The patient has difficulty walking. Now, then we talk about grading and staging. I'm on page 499. Grading and staging, very, very important. Anytime they say grade 4, stage 4, that means the cancer is really bad. That is terminal cancer. Now, students will say, I will ask you, who's at risk to have breast cancer? You will say, the lady who got hit in her boobs with a ball. No, cancer has nothing to do with her. It's cell, and aplasia, dysplasia, right? Right, so let's talk about that. Grade. So I found a lump. The cells is different. That is mild dysplasia. Grade 2, the cells are more abnormal. That is moderate dysplasia. Grade 3, the cells are abnormal, severe, right? Dysplasia. And grade 4, anaplasia. Anaplasia, right? That is the worst stage, that is the worst grade you can get of a cancer. Any question? So cancer get a grade and a stage. Stage 1, I see the lump. Stage 2, the tumor limited to the tissue. Stage 1, the tumor limited. Stage 2, limited local spread. Stage 3, extensive regional spread. Stage 4, metastasize. So grade 4 is what we call anaplasia. Stage 4 is called metastasize. Is spread. Now, in your skill book, the skills for cancer is on page 387, the correct way to do self-breast exam. You must know it. Which finger? 348 in your skill book. 380, 86 or 387. In the skill book, okay, find the skill book for me and let me show you. Because I don't want nobody to say it's hard. The girl just went and they asked her which finger. right? The padding of the finger. I'll show bon minute. West side. Put it in water. Minute. Put it in order. Put it, guys, if you don't do skills, you ain't gonna pass. Hang up, hang up. You must know how to do skills when you're both full tool. When you do self-breast exam, you never sit. Oh. Either you stand or you lie down. You must know how to do the self-breast exam. What age? 50. 50. Breast cancer. Students love to say genetics. Let me tell you what genetics. Grandma, mama, PT said. That's genetic. Not cousin of the third, cousin of the fourth, cousin of the cousin down the street. No. It's intermediate family who's at risk for breast cancer. Now, NCLEX asks you a question on this BRCA business. Yes, since Angelina Jolie, a BRCA is a DNA test that does not say you have breast cancer. It only tells them what are your chances. Some people go remove the breast and don't even have the cancer. But remember, when you remove the breast, you better remove the ovaries and everything else. Because once you at risk for one cancer, you at risk for all. And that's why Angelina Jolie didn't just remove the boob. She did a hysterectomy too. Because once you at risk for breast cancer, you also at risk for uterine and also ovarian. Not cervical. Cervical cancer, you get it through sex. Ovarian has nothing to do with sex. Uterine cancer. This is what's killing people now. AIDS back 2 years ago. Only that big C, ovarian cancer. And ovarian cancer kill you quick because it make it look like gas, acid. So you go to Walgreens, you keep buying times, and tomorrow you're in hospice. Number one cancer in your community right now, ovarian. Has nothing to do with sex. Cervical cancer has to do with STDs. Any question? All right, so please, put it in order. Put it in order. Not this one, yo. Which finger? So nice. Petit boîte la comme ça. Nice. Lay out. And listen. Miss Sonia never asked you to do all skills all over the world. How can I ask you to do that? I didn't do all skills all over the world. Certain skills you cannot go to NCLEX without doing. NG2. How to put an NG2 fully. Every system I do, I will tell y'all what skills to do in the system. I cannot send you do all the skills in the world. I didn't do all the skills in the world. But you need to know the most important skills. You got, and this is one. In cancer, you got testicular, the boy, and you got the self-breast exam. There you go. Thank you. Okay, make sure we're clear. And behind your skill sheet, put boxes. Nice. And each system, you know you do your skills that go with the system. That's it. There ain't nothing to it. You just got to do it. Any question? Then we go to box 42-3. Caution. Anytime you go to NCLEX and they ask you what is C, what is A, what is U, T-I-O-N, you don't fail a people test. They don't ask it to you like that. They put it all that apply, right? So let's go. C is what? Coughing. Change in bowel, right? Yeah, also coughing. Coughing has to do with what? Lung cancer. Any sore that does not heal. Unusual bleeding or discharge, that's cervical cancer. Cervical cancer, you see poo-poo come out the vagina. And they will do a pelvic externation where they cut this and make your rear look like your front. You don't have a vagina. It's no good. They threw it out. Right? Pelvic externation, we'll do that. We'll talk about that. Thickening or lump in the breast. Okay? Indigestion. Indigestion, you see? Ovarian cancer. Anytime you have ovarian cancer, guys, it look like acid, GERD. Women, indigestion for us can be few bad things. Right? Ready? MI. Ovarian cancer. Or GERD. Or GERD. Right? Now, changes in wart or mole. Nagging, cough, or hoarseness. All right? Who's going to do a... Can you take off your shirt? No, I just want to do a breast exam for you. Come here, Robin. Let me show you. They asked you how to do it. She got it on her test. And she said, the one you did up front. So let me go get a glove. Come on, Robin, because you good. So, you must know how to do a self-breast exam, right? They're going to ask you which finger. You remember? Look at that little box. You see this? Page 499. Use the right hand to examine node. Go to the padding. Use the pads of the fingers on your left hand, right? Make sure the padding of your fingers. They ask that. So how do you do a self-breast exam? T. Robin, come here. I'm not going to expose you. The reason I use her is because she got the tank top. So put this up, Robin. So normally, when you have a breast cancer, it never starts here. Turn, Robin. It always starts here, which is called spins of tails, babwa. The lump is always here first. And if the person, you touch them and it's kind of non-tender, you can tell if she on her period because you can find lump. You're not on your period, are you? I can tell because there's no lump. Last week, the night class, I found one. It was big. I said, you on your period? She said, how you know? Because it feels. So you got to be careful when to do this. When will you do this? 7 days after your menstrual, right? So you check here. You always start here. So you check for the humps, right? All around. You check it, right? Now, then you go in the breast. All right? When you do the breast, guys, you don't go, see, I don't have nothing, no hump. When the hump get here, it's late sign. First, the hump come, but it's sloppy, it's boggy. Then it become firm. Like I got, it's worse. So when you check in the woman, you remember you go just like this, around. You see? You press hard. Well, she having a wire bra on, and you go all around, buddy. All around, all around. This is the one, no, around. You could go around, or you could go spiral. S, or you can do this. Now, when you finish, you gonna take the nipple, and you got to squeeze it. If she have discharge coming, now if she breastfeeding, come on. But if she have discharge, that's not a good sign. Or then you're going to ask her to do this, look. Right? She should have one shorter, but not one here, one here. you'll see them one little short. It's okay, but you're looking for symmetry. If one is up, one signs of breast cancer. The reason sometimes we detect the breast cancer late because you're looking for lumps. Not everybody have lump on it. People be having the lump right here in the Spencer tail. That's why when you go do your mammogram, that's the first place they go. They go right under the arm. They tell you no deodorant, no perfume, no powder, no nothing. Any question on how to do the self-breast exam? Where do you do it? Not in the bathroom. Yes, old books say bathroom, but I'm going to tell you no. Why? Because what happens is the bathroom is warm water, right? And if there's a ball, a little lump, it will what? It'll fade. So you come out of the bathroom, in the bedroom, and you keep it soapy, and you do it. And then when you finish, you rinse off. That's the best way to do it. 7 days after your period. Any question? Thank you, Robin. To the second and the third finger, the padding. Okay, hey, your body, they gave it, right? And Althea gonna come in here tomorrow, her narcissistic self, and she's gonna tell you, she had it. The girl that's coming tonight had it. Make sure. And the way they do it, guys, they give you 1, 2, 3, 4, and you gotta give them 5, 6, 7, 8, 9, or they give you 5, 6, 7, 8, 9, and you give them 1, 2, 3, 4. So survive we do it. You gotta read all of them. All right? Any question? And page 499 has it. Okay? Now, let's continue. Then 500 testicular exam for boys. What age? 14. 14, not 12, 14. 14. Right here. You see on page 542-2. Okay? Gently roll each testicle between the thumb and fingers to feel for any lumps, swelling. If you notice any changes from 1 month, notify your doctor. Now, what does it supposed to feel like? Each testicle should feel like a what? Egg. NCLEX question. 14. 14. No 12. Too baby. 14. All right? You see it? Do testicular cancer right here. Don't do it in the skill book. This is best. Right here, sir, 42-2. You see it? Right there. We cool? Yes.
14 years old. They're going to do it by themselves or what?
Yes, you have to teach them how to do it. They're 14. 14 is in high school. Right? Is it 14 in high school? Yeah. Yeah, you have to teach them how to do that. Not only that, you got to post it all in the school. If I put a poster, what is that? Primary, tertiary, what is that? Primary, because that is what? Prevention, right? The actual doing it. What is that? To do it. To do it. To actually do it is secondary. Teaching is primary. Here's a pamphlet. Primary. I put a poster. Primary. To actually do it, secondary. Tertiary is things you cannot change. If you have AIDS, you have AIDS already, I cannot teach you how to prevent it. Managing is tertiary. So primary is teaching, secondary the actual test, and then tertiary is management. Okay? Now, let's go. Yes.
Is there also asymmetry like with the females?
Yes, you always see one long, one short, but not so short. You see a little off, and male too. But you gotta be careful, watch for male, it's not under, because that's a disease inside, impedes when the testicles under the leg. No good. for kids, so you gotta look for the testes that they distend. Yes, any question, we cool? Once you have cancer, I don't wanna say cure, I gotta watch that word. Mabzi, manage. We manage it with either chemo or radiation. Chemo, it's a group of drugs. Another name for chemo is called nadir. N-A-D-I-R. Nadirs. Okay? Chemo, I told you it comes as a group of medication. 99.99 chemo come in. Chemo come in IV. 99.9 you give chemo IV. Shh, shh, shh. I'm on page 501. You're going to start on number 5. 501, we're playing number 5. Usually medication is used in combination therapy. Number 6, the nadirs. Another name for them is called interneoplasm. So you're in a chemo nadir, you're in your interneoplasm. I'm on now number 7. Number 8, the preferred route is IV. 501, I did number 5, number 6, number 7, and I did number 8. Now I'm on number 9. Anytime you are on chemo, side effect is nausea and vomiting. So, for the nausea, you will give me small, frequent meal. For the vomit, you will give me cracker ginger ale. Another side effect of chemo is alopecia washromperic. You make them cut their hair before, right? Because once they start the chemo, the hair just start coming off. You make them cut their hair before, you get them wigs, and NCLEX have question. Suppose the patient say, is my hair gonna grow back? Yes, but not the same. It will come back, but not structured like normal. It's like baby hair. Yes, soft. But will it come back? Yes, but baby. Alopecia. Now listen to me. Where I get you on my last exit, students always think alopecia is caused by cancer. No. Alopecia is caused by the chemo. Okay? Now, mucositis, right? Where your mouth burn. Your mouth burn, right? Because the chemo, you cannot have spicy food, lemony food, hard food, pussy go fried chicken, and these things that burn the mouth, no spicy, right? So sometimes the doctor, a lot of time, will order something called Nastitin, with white bushla, right? They give it for people who have thrush, right? So the doctor will order that for that. Now, you gotta be careful. When the patient is on chemo, you always isolate them because the chemo causes immune suppress. So again, guys, you don't isolate them because of the cancer, but the chemo. No fresh flowers, no roughage, right? Also, chemo causes bleeding. So no big thing you give rectal, rectal, no big sticks because they're at risk for bleeding. Chemo causes anemia, so safety. Get up slowly. Look for pallor. Look for fatigue. Any question? Guys, anytime NCLEX asking you a question on chemo, terminal. The word terminal means death. Trust me, they gonna come at you with a DNR question. Be ready for that. DNR, terminal, chronic pain, right? Terminal means patient is getting worse. All right? Any question? That is chemo. That's it. That's all chemo you got. Don't go no, do more. Oh, yes. Yes. The reason they cannot eat fruits. They cannot eat certain fruits. Certain fruits fruit that will keep their life, banana, peach, kiwi, strawberry, bagaisai. But those orange, they can have it because the orange, before it gets white no good, it becomes soft. It will not cause flies unless 10 days later. So you gotta make sure. Yes. No, parce que piqué will cause burn. You should bouler. Because, listen to me, the juice is concentrated and it causes it to burn big time. The orange is bad too, but what I was trying to show her is what type of fruits is bad. Okay? And this patient on neutropenic precaution. Leoti neutropenic, what make they gun, glove, gown, mask, and you buy your boost. And be careful with the boost. Be careful with the boost, guys. The boost, see, a lot of chemo patient immune suppressed, right? And boost is normally given with food. See, a lot of LPNs have issues with that. They give Ensure with the meal, boost with the meal. And I'm going to tell you why. If I bring her a tray, she only eat 40% of the tray, then give her Ensure and she drop 30%. I'm now going to consider the Ensure and that 40% as one meal. You got it? That's why you see the doctor order the Ensure, the boost with the meal. They'll eat tikal and then drink the Ensure. And together you must add them up. You guys know that. LPN, y'all pass it all day, all night. Right? But don't have a clue why they give the Ensure. Right? Because it is considered as a meal. Because sometimes they say, go drink a Nutriment. Do a little shake, and that's all you need for the day. That is considered a meal. Yes? No, it's not considered. No, if she ate 40, and then she took 30 of that, that's 70. But if she ate 50 of her meal, and she drunk 50 of the Ensure, that is considered 100 of one meal. Okay, very important, guys. You guys understand these things, why they do that. You don't just give the patient Ensure alone. You know that. AIDS patient, it's always food with Ensure, right? Because you try to watch calorie intake, right, to fatten them up. Yes?
If the patient on chemo, and then they need a family member in the house, what do
Mm-hmm.
the patient on chemo, but they home with family member.
They can. It's radiation. I'm going to talk about that next. Yes? Tande, chemo asena IV mbauli. She my cousin. She right in the room with me. Immune suppressed. Now let's answer the question different. I can get her sick because her immune is low. You understand? So you got to make sure she can get visitors. Limit. The person got to wash their hands, wear a gown, because her immune is low. But that don't mean we can't live in the same house. Now we're going to go to radiation. Any question? Anybody understood what she just asked? They say neutropenic precaution. I'm in the house. This is my cousin. I have cancer. I'm on chemo. She come visit me. Guys, my immune is low. She's not going to go, chill. You're going to watch that. But that don't mean I can't get visitors. Even radiation, they can get visitors. You're going to limit. But specialty room. Kids live off friends. So if they sick, they don't have friends their whole life, and right? You limit visitors, but you don't say no visitors. All right. Then we go to radiation. Now, radiation what is radiation, Miss Sonia? Radiation is like tasering. You guys know what a taser? Fire. There's two types of radiation. External, right? And what we call brachytherapy. And we'll talk about it. Radiation. You can do radiation and chemo. You can do chemo alone, or you can do radiation alone. Let me tell you where they will do radiation alone. You got a low wart, skin cancer, radiation. She got a low wart. Why give her chemo everywhere? No. She had lung, or breast. It spread konya. No more radiation, c'est qui ça? Chemo. The crime must meet the punishment. Cervical cancer. They put the radiation in the implants. They put the implants inside of you. That's the one if you touch, if it fall on the floor, you pick it up with your hands, it'll burn. We're going to talk about that. Okay? Any question? So radiation, there's two, right? There is two types. External, right? Outside. And there's brachytherapy. Just remember that. External and brachytherapy. And brachytherapy have sealed and unsealed. So let me put it on the board. Because I see y'all looking at me like, lady, what they do? Alright? Alright. Radiation. There's two types. Type 1. They call it external. They are outside. You with me? Type 2, right? It's called brachytherapy. And that's where your NCLEX question is sealed and unsealed. This is where your NCLEX question comes from. So radiation, there's type 1, external, which they normally do for wart skin cancer. So we'll put skin cancer. Right? Type 2, brachytherapy, got sealed, unsealed. Let me tell you what NCLEX do to you. They say the patient is on brachytherapy radiation with phenol. It's you now who have to say, ooh, are they talking about sealed and unsealed? Or they put brachytherapy. You got that? So right when they say brachytherapy, you know this coming up. Seal and unseal. I'm going to tell you. But I don't have to put seal and unseal. If you comprehend, if I put brachytherapy, you should understand. You got that? Okay, Anani. Turn to page 502. You're going to see 3 boxes. Right? Whose black recorder? It's not working. We're going to put it right here for you. Okay? The box 42-5, I want you to put external. You see? External. Girl, I know you about to die. It's off, darling. Oh my God, the world gonna end. Ooh, praise God. You better get it working. She gonna go crazy. Her friends help her. Right? I know her well. Okay? Okay, so listen. External. This goes on skin. Ready? Wash the area. with mild soap and water. Make your NCLEX Joey. Use your hand, no towels. A, rinse the soap thoroughly, and be careful not to take off the markings. Parce que you mark it, they mark the site. Like a permanent marker, don't try to efface it, right? Now, make sure you know that. Dry it, pat it, like this, look. Right, pat in motion. Use no powder, use no ointment, use no cream, no deodorant. So listen, I'm putting fire on her skin. Suppose it's burning. What are you going to tell her to put? Sterile, dry gauze. No powder, no lotion, no crème, no nothing. That's an NCLEX question. No bags, no jewelry, no tight clothes. And if she's going in the sun, she needs to wear light clothes. No big sweater. Any question? Sigh. Not this blue sauce. Nada. Hey, on this are serious. Now, pay attention. You taping, right, my girl? Because this is deep. Now, here it is. Brachytherapy come in sealed and unsealed. You're going to go with me to number 3, 4. I'm going to read it, and I'm going to say it 2 times, right? So brachytherapy includes sealed or unsealed. You see it? Okay. Millie, unsealed can be given oral or IV. The source is not confined completely to one body area. It enters the body fluid and eventually eliminated via excreta, meaning through sweat, through fluid. When does it come out of the body? 48 hours. So listen, she who have unsealed radiation, just had it, come home. Can I use her bathroom? No. Can I use her towel?
No.
No. Can I use her spoon?
Yes.
Can I use her plates?
Yes.
Because they are washed. You cannot use her towel. You cannot sit on the same toilet with her until what? Any question? That is called unsealed. Okay. Seal, which is still brachytherapy, right? Seal can be temporary or permanent. There you go. Seal, you normally put in cervix when you have cervical cancer. Seal, the only time I can radioactive my husband if it's inside of me. Remember, it's temporary or permanent. So I have it temporary. I take it off, I cannot radioactive him. If we want to have sex, we have to wait 7 days to have sex. And not only wait 7 days, I got to use that special douche. You know that $10 douche that has that iodine in it? That and plus use an enema. 7 days, use an enema, use that douche, then you can have intercourse if it's temporary. As long as it's permanent, you cannot have sex. Long as it's inside of you. Sila. Any question? West side. Love this one. Okay, I'm telling you, sealed and unsealed, they love to give it to you. Now, then we're gonna talk about sealed, box 42-6. Sealed, the door is closed. Sealed, if I have it Remember I told you seal normally cervical. I have to stay 6 feet away from the source. So if it's cervical, I'm going to clean you like this. Look. Pa, 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 out. And I'm getting it. You understand? I go. So wherever the seal radiation is, that is the place I do last. And I'm 6 feet away from it. Now, seal. This is where, as a nurse, I can say I don't want more than one patient. If there's 3 patients, you're going to give me one, going to give her one, going to give her one. You're not going to give me 3 seal radiation patients. If I'm pregnant, I cannot take care of this patient. Visitors are limited. Now, it's time for you to go home. Before we set Mary Pierre to come clean the room, you must call radiation department. Remove all the radiation, then the cleanup lady come clean. The cleanup lady don't come clean the room. So the patient finish, everything stay in the room. The dirty linen, the dirty everything stay in the room. Everything in the room, radiation department come first, clean the room, and then we call the cleanup lady. She come clean the room. Now, every sealed radiation patient, you are to be with them 30 minutes per shift, 8-hour shift. So 12-hour shift, 30 minutes. So we're going to spread that 30 minutes very thin. 5 minutes here. You're not going to give her all 30 minutes at one time. You're going to do 5 minutes, 2 hours later, 3 hours. You spread it out. You wear a dosimeter. You know why? Because if you get radiation, you can't sue the facility because you have no business being in that room more than what? 30 minutes. You do cluster care, CNA, LPN, you tout venir nettoyer patient together. Y'all come clean and we out the room. You don't go in the room talking, how you doing? Because the dosimeter going beep, 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 beep. That means you're not doing what you're supposed to be doing. Any question? That is only for which type of brachytherapy? All right. Know that box. Did you get this? 42-C. Now, all the equipment stay in the room except what? Stethoscope, very towel, sheets, tout black, line, soulier, everything stay in. Anything that hold moisture stays in. We cool? Okay. Now, box 42-7. And visitors cannot be less than 16. That's an NCLEX question. What do you know about kids? They got runny nose, they got sniffles, all kind of problems. Right? Now, here it is. If their seal fall on the floor, you do not use your hand. You do not put it in the garbage. What will it do to the garbage? Burn the garbage. So you use a what? Forceps. And you use a metal. Yeah, metal, put it in a metal dumpster. Any question? Make sure you know that. Right? We cool? Okay, so tomorrow, look. So today we did chemo. That's the drugs and radiation. Tomorrow we will do cancer. Right? We do